Thank you so much. Thank you all for being here, and thank you to Karen and Sharon who asked me to moderate this incredibly important conversation tonight. I feel like I can't overstate the importance of this issue that we're talking about, and I suspect that it's touched every single person in this room. But just by way of demonstrating that, can we see a show of hands for anybody in the room who has had caregiving responsibilities for an elder parent or family member, children, an ill spouse? It's touched. I certainly should be raising my hand for several of these categories. So it's common in many circles to talk about the need to find quality, affordable care. And it's very common in other circles to discuss the conversation about how to earn a living wage while providing care for pay. And the conversation we're going to have today is one about bridging the gap between affordability and fair wages from the caregiver's perspective. And there are challenges and opportunities for that. Just a little bit of data that the Fund for Women and Girls, which has the most professional and organized staff of any nonprofit organization I've ever been associated with, they provided this data to me, and so they made this job easy. There are over 2 million women who serve as caregivers, performing household labor, family care, or providing transportation and other duties. Caregivers, both paid and unpaid, are overwhelmingly women and primarily African American or immigrant women in the United States. Experts estimate that only 5% of paid caregivers, employers, pay them on the books, and 65% of caregivers do not have health insurance. Of course, given the racial makeup of most domestic workers and caregivers in the United States, we can't separate their experience today from our history of forced labor, because for many centuries at the country's founding, of course, enslaved women or women who were immigrants and came here as indentured servants were in the position of providing care, being forced to provide care for land-owning and property-owning families. And of course, the residue of that remains with us in the issues that we're going to be talking about today. But at the same time today, the rights of caregivers is an issue that cuts across race, class, immigration status, and impacts millions of households because it impacts the women who are providing the care for pay, and it also impacts most of us as women who organize the work to make sure their families are cared for either by us or by the caregivers who we're working with. Care needs are only going to increase in this country because as baby boomers retire in age, they're going to become into the category of people who need care rather than the people who've been providing the care as much. Although I've also learned from the amazing reports that our panelists have done that many people in this country actually into their 60s provide care for even more elderly family members. But baby boomers are 10,000 people a day turn 65 years old in the United States, which is one person every 8 seconds. And then we have millennials on the other end of that spectrum, people born between 1980 and the year 2000 who are having children and building their families and also in the workforce, so they need care. They make up about 25% of our nation's population and 1/3 of the labor force. So clearly the question of how to structure, support, and improve the lot of all women who provide care is crucial to the short and long-term investment in the health of our families, our communities, and our economy. So I'm delighted to turn this conversation over to the real experts in this field, our panelists, who, as Karen said, their bios are in your programs, and I encourage you to read them because they're all amazing. We have analysts, innovators, and disruptors. Each of our guests will share her perspective on caregiving and those who provide care. And then I'll have some questions for them, and then we'll end with questions and answers from the audience. And so I'm going to now turn it over to Natalicia Tracy.
All right, thank you.
Thank you.
You're going to keep track of time, right?
Heather's going to.
Oh,
yes,
great.
thank you.
All right, because we can keep going. First of all, good evening to everyone. I guess it's evening already. I want to thank you, everyone. I want to thank you, the foundation, for inviting me here this evening. One thing that I left outside my bio that it's really important is that I was a caregiver for 15 years. I was brought here as a nanny, and then I took care of elderly and children with disability during the whole time that I was going to school here. And this is how I got involved in the movement for changes. and also become the executive director of the Brazilian Workers Center. The center was started by workers for workers, first initially in Boston in 1995. Workers who are facing a lot of marginalization, exploitation, wage theft, so they got together to start a center because they couldn't find a place to support them, and they want to educate and organize for changes, so they start the center then. And then later on, we got invited, after we passed the Massachusetts Bill of Rights, around the time that we are organizing, we got invited to come to Connecticut to start organizing here. So in 2012, we initiated organizing domestic worker here in the state of Connecticut with the same purpose. At that point, we were already part of the national movement, working with the National Domestic Workers Alliance and learning from other states, learning specifically from New York, which was the pioneer state, and working with workers across United States through the umbrella organization, and of course everyone knows Ai-jen Poo, our fierce leader, and across the country. So, as we heard from Miriam here, Connecticut depends on over 40,000 domestic workers every day to care for children, elderly, people with disabilities, and we forget them. They're completely invisible. And it's very important that we pay attention to that, because without them, we can't go out and do all the other work. At the national level, we talk about that. That's the work to make all the other work possible. And we also talk about the chain of care. This is not something that is just happening in Connecticut, it's happening in the United States. Globally, women is moving from south to north constantly to leaving their children behind to care for children globally. We also part of the global movement to create changes. The Convention 189C passed in 2011 with the goal to put forward decent work. What does it mean, decent work? It started with the fact that we need to recognize that this is real work. And that's the first part of it, right? We need to create set of standard and recognize that this is not just women in the home anymore, and this is people who leave their homes and need someone else is somebody's work. And that's the first part of it, is recognizing that this is a real industry and making sure that labor standards are recognized as such. That's the first part of it. And then creating standards such as, when do you start your day? When you finish? What are the job description? What it entails, right? And then set pay rates, and then set of regulations that we don't have right now. Right now, only 8 states, we say 9, because Connecticut has passed one regulation under the civil rights. And also Seattle has passed within the city. And then I know Philadelphia is about to pass something. Just last week, New Mexico passed a Bill of Rights, right? So we are making small steps towards creating changes, but Bill of Rights is something that is very important because it creates a set of standards that regulate the industry. We understand that right now we depend on over 2.5 million workers every day, right, in the United States. But we know the growing need is fast. We're gonna need 3-folds by 2030. Because the most important thing that this country needs to do is make sure that the baby boomers can stay home. All the research points to the fact that the quality of life is better if you stay home. It increases fast the quality of life for people that are put into institutionalization, right? So all you need, if you can get someone to come to your home and support you with your very basic needs, you can continue to have an independent life, and then the quality of life, it's measurable what you can achieve by staying home. So a lot of the jobs that a domestic worker perform, and I was looking in your fact sheet, and all the workers later that are here with me says, oh, in your list of, you don't have domestic workers, but we do all those jobs that are listed here, right? And I think the reason why it's not there is because it's not seen as a real job. But workers do all those jobs that are listed on your fact sheet there. And of course, the growing need is just going to call for professionalization of workers. That's one thing that we're doing right now in our organization, is saying the more we can work to professionalize the workers to make sure that it's understood that it's a real job, that they need training, it's better for the care recipients. All right, I have 2 minutes. So policy-wise, the reason why we continue to push for policy in the state of Connecticut is because we only change a small provision. Before, the CHIO couldn't even take any case from domestic workers. Now, if you work 3 or more in the state of Connecticut, now you can file a sexual harassment and discrimination case, 3 or more in a home, right? So we want to move to 1. Because how many of you have 3 employed, 3 or more domestic work in your home, right? So we want all of it. And we also want more provisions. We want a full bill of rights. We want to make sure that minimum wage is covered. We want to make sure that a contract that you can negotiate with each other to make sure all those other provisions that we have one in other states are also available here in the state of Connecticut. And I think I'll stop here because I'm running out of time, and then if you have any other questions for me, I can answer them later. But the most important thing that I want to leave here today is that workers have been invisible since the 1930s. They've been excluded from all the important federal laws, the National Labor Relations Act, the Fair Labor Standard, the Civil Rights Laws, OSHA, and it's time to change. And I need all your help here in this room. It's a shame that with Me Too and all the other workers have those rights and domestic workers don't. So we need to change that. And we're hoping to introduce the bill next year again. And I'm counting on all of you to help us this time to change that. Thank you.
Up next. First, thank you to the Community Fund for inviting me here today. You're going to hear some common themes, I feel like, across the whole panel. For those of you who don't know much about my organization, I work for the Institute for Women's Policy Research. We are based in Washington, D.C., and we have been around for 32 years. And we are the leading think tank in the United States that uses a quantitative and qualitative lens to do research with a gender lens. So we work with policymakers, we work with foundations, we work across the board. Some of you might remember, and in 2012, we put out the Status of Women and Girls in New Haven report with the Community Fund. So we're here today to talk about this very important issue, and I'm here today to talk about the conjoining of caregiving and the wage and wealth gaps. And as we've heard, there are some heavy implications on the wage and wealth gaps that we're seeing in our country. And I think they're heavily connected to how we work with caregivers and how we are as caregivers and how we value caregiving. So that's what I'm going to talk about today. So I'm going to look at it kind of from 3 angles, from the providers, from the consumers, and then unpaid caregivers. So providers, we've already heard a lot of statistics. Paid caregivers, majority of them are women, specifically women of color and immigrant women. So these are issues that disproportionately affect these women in our society. They're often paid some of the lowest wages, as you can see here. Like Natalicia said, they do all of these, and so domestic workers are kind of in all of these categories, and they're paid very low wages, which makes it hard to live, especially if you're trying to care for your own family. They also don't have a lot of employer-provided benefits, paid family leave, paid sick days, health insurance, retirement plans are pretty much non-existent. If you think about low-wage workers and high-wage workers, 9 in 10 high-wage workers have access to some sort of paid leave. Only 1 in 5 low-wage workers do. So we're really seeing this dearth of employment benefits going to people who are already earning higher wages. Paid caregivers are also more likely to work part-time. If you look at the data, they are oftentimes working part-time because they have their own families to care for, and they're already working for low wages. Again, these are huge things. We call these wealth escalators, the employment-provided benefits. These are benefits that help you stretch your dollar further, help you save, because if you don't have health insurance through your employer, you're gonna go have to pay for that. So if you're earning low wages and you don't have benefits, you're really not able to save, you're really not able to have economic security over your lifetime. For the consumer, those who pay for caregiving in the United States are under an immense burden financially. Childcare costs for an infant are oftentimes more expensive than in-state college tuition in most parts of our country, including Connecticut. So I looked it up, the most recent statistics in Connecticut for an infant, and up to actually almost up to 4 years old, it costs almost $15,000 a year to put your child into care. That's $3,000 more than in-state tuition at a public university. It's astronomical. And adult care is also very expensive, especially if you need long-term care for someone who has a disability, or if you need long-term elder care. These are really, really expensive things, and health insurance does not cover all of the costs. Then we go to unpaid caregiving. So everyone, male, female, is likely to need to take time off work in order to take care of themselves, to take care of a child, or to take care of a loved one. So having access to paid leave is critical for our workforce. But we know that this burden most likely falls on women. As you can see in our lovely statistics sheet here, women are more likely to be providers of unpaid care in the home. This means that it impacts women economically. So how does it impact women economically? Well, women are more likely to work, again, part-time because of their caregiving needs, or to drop out of the labor force altogether. Again, this impacts retirement savings. Social Security benefits are reduced and lowered drastically for part-time work, and because it's based on your wages, and time out of the labor force altogether. It's actually estimated that when women exit the workforce due to caregiving responsibilities, they lose almost $325,000 in income and benefits over their lifetime. And again, I say women, but let's also be honest that this disproportionately impacts women of color, Black and Hispanic women, immigrant women, women who are already earning the least. These are huge economic impacts on these women. And it really affects the ability to build wealth over your lifetime. And when I say wealth, I don't mean like the 1% wealth. I mean, if you have an emergency expense this month of like $300, $400, can you pay it? That's what I mean by wealth, having that security that when an emergency comes up, that you're not left in destitute. You don't fall into poverty. So IWPR has recently done a study in Central Ohio. There's no state-level data on wealth gaps, but we conducted our own study there. We did a survey and focus group interviews, and one of the themes that kept coming up in our survey and focus group interviews was that the high cost of having children and caregiving was identified as one of the major barriers to building wealth for these women. And in our Women of Color focus group, the participants especially noted that they're not only responsible for caregiving and the care of their immediate family, but for extended family as well. So they're carrying an even larger burden than a lot of other women. So what does this mean? This means that women lack wealth. There is a huge wealth gap, and I know we talk about the wage gap a lot, and a lot of people are familiar with those numbers, but I wanted to leave you with the numbers of the wealth gap. According to our analysis of the most recent data from the Survey in Consumer Finances, single women on average own 40 cents to the dollar that men own, 40 cents. Hispanic women own 8 cents on the dollar that men own, 8. And for Black women, 2 cents on the dollar. And Black women, on average, the median net wealth for Black women is only $300. So I will leave that there. There's a lot more I could say on this issue. I can talk your ear off, so please ask questions, but I will leave that there for now.
So I'm going to focus specifically on one part of the caregiving system. I'm going to talk about childcare. My name is Jessica Sager, and together with Jana Wagner, I run an organization called All Our Kin that began here in New Haven with the support of the Community Foundation and the Fund for Women and Girls. And by the way, we have several All Our Kin team members here. Maybe you guys can just quickly wave your hands. Thank you for coming out. Let's talk about childcare. I used to say that the childcare system in the United States was broken, and then I realized that was giving us too much credit. We don't have a childcare system. It doesn't work for children, it doesn't work for families, and it doesn't work for caregivers. So in the absence of such a system, what happens is that women, and it is primarily women, and primarily Black and brown women, across the country open their homes to care for each other's children. They step up and they fill a gap that we have left by failing to support families. These caregivers play a critical role. They are able to offer high quality, loving care in communities that are in desperate need of that care, and they are operating micro businesses that are generating significant revenue. But we overlook and ignore these caregivers. I think a theme that you have heard across this panel is this theme of invisibility and devaluation, and this applies to family childcare providers as well. There's lots of stereotyping of family childcare providers. They tend to be viewed as babysitters. They're underpaid. They're often left out of professional development efforts. And this is a terrible missed opportunity because the women who are the greatest source of support for children and families aren't themselves getting the support that they need to succeed as business people and educators. So what we have done at All Our Kin is to really flip that paradigm and say, we're gonna bring the very best professional training, the latest about children's brain development, the latest about learning theory, and the latest about how to run effective business practices to family child care providers. And that is what we have done, first here in New Haven, and then in cities across Connecticut, and now in New York City. And the results that we see are profound, because we see time and again that family child care providers can and do offer high quality care to children, and it is care that meets the needs of today's working families. So I'm talking about care for infants and toddlers, care for families working non-standard hours, care for parents for whom transportation is a barrier, for whom affordability is a barrier, for whom English may not be a first language. Family child care educators make it possible for these parents to enter and succeed in the workforce while feeling good about where their children receive care. And these family child care educators are also important economic drivers because, as I said, they are building micro businesses. And I think when we overlook the critical role of these small businesses, we really miss out on an important piece of the puzzle. At All Our Kin, we worked with the University of Connecticut's Center for Economic Analysis to really look at the extent to which family child care providers are economic drivers in their communities. And here's what we found. Every family child care business makes it possible for 4 to 5 parents to enter and remain in the workforce. A family child care educator who gets training and support in running her business can expect to earn at least $5,000 more. And in fact, we have some numbers that show that providers that participate in our business coaching see a 90% increase in income. And the combined impact of parental earnings and provider earnings generates revenue to society of $15 to $20 for every dollar we invest. But our direct service model is not enough. 3/4 of the children in our family child care programs are paid for with government subsidy dollars. Because, as you have heard, child care is incredibly expensive. And somehow we have set up a system that parents cannot afford and that does not permit child care providers to meet a decent living. And the only way to do that is to restructure government investment. We have one block grant, the Child Care Development Block Grant, and to the extent we have a child care system, it is built on this flimsy, underfunded program. We need to think about investing in universal child care for children 0 to 5. In a way that truly values the needs of children, yes, and of parents, and of caregivers as well. Thank you.
Thank you so much. I have learned so much from each of you in preparing for this and from hearing your remarks as well. So I have a few questions for each of you and a couple for the panel generally. How am I doing on time, Heather? Okay. I want to start with a question for Natalicia because just in Connecticut, just this past week, and as I understand it might be signed into law on Tuesday, we finally have a new piece of legislation that might be relevant to our conversation here today. And I know that 8 states have passed Domestic Workers' Bill of Rights, including Connecticut, and what other progress you might see as a result of places that have put this legislation into place and what impact it's having and where you think we can do better and what opportunities we have in the future.
Yes, so as I stated earlier, 8 states have passed Bill of Rights, such as New York, California, Nevada, Oregon, Illinois, a few other states that I can't remember right now, Hawaii. What we're seeing there is progressive employers working with workers in the state to create workers' respect, fair pay, and a culture that workers become more visible in professionalizing the industry. Because one of the problems that if you need care and if you're a recipient of care that we wanted to avoid is the fact that there are a lot of turnover. And people complain of this, where every time you open your door in the morning, you have a new caregiver, especially if you need intimate care. It's a big problem, right? So if you have a caregiver that stays with you for 5, 10, 15 years, it's a wonderful thing. And if she's professionalizing, she gets training, it's even better. And so those states, we're working with the state, with the regulations and enforcement to educate employers, but also to provide trainings to workers. So it's for both. It's about quality care, but it's also about quality jobs. Also at the national level, we work on portable benefits. So workers also, you heard that most of them, they never have any type of benefits. So they have to worry about their own aging as well. Who's going to care for them when they age if they not accumulate any type of benefits, right? So those states are working all of that. So that's what we've seen progressively working on those specific for recipient of care, but also for workers.
Thank you. Elise, can you give us some policy recommendations to address wealth accumulation implications of caregiving, which is something that you touched on in your remarks, but I'd like to hear more about what you recommend for the future and how paid family leave factors into that, and why family paid leave is considered an escalator issue.
Yeah, definitely. First, as far as those kind of wealth escalator issues, I'll touch on that first. Simply put, again, it's benefits, and they don't have to be employer provided. It can also be tax benefits. It can be, policies that really help you make the money that you earn go further. It gives you the ability to save and to plan for a rainy day. And then maybe even, in retirement, have economic security. The fact that women are more likely to live in poverty once they retire in elder ages is a huge issue. So policies. Connecticut's actually doing decently well on a lot of policies that we recommend for addressing these issues. Paid family and medical leave. Yay, Connecticut passed paid family and medical leave. So pat yourselves on the back. Connecticut was also one of the first states to pass paid sick days laws, so that's also fantastic. Expanded access to health insurance is huge, especially for people who don't get employer-provided health insurance. Again, Connecticut was one of the first to expand Medicaid through the ACA, and just recently made sure that they averted cuts to eligibility. So those are fantastic things. And then also you have the minimum wage issue that has been the discussion that's been going on here. These are all policies that really get at wealth accumulation and caregiving and how it would help those who provide care and who provide unpaid care. Areas for improvement. We talk a lot about this thing called a caregiving credit added to Social Security benefits. And what that would mean is for people who really do have to take years out of the labor force for caregiving, to provide caregiving for a loved one or themselves, they don't lack those benefits. They get credit. Even though they're not working, they can still accumulate Social Security benefits. Again, this is really important for women who rely more heavily on Social Security in elder ages. Again, affordable childcare is huge. And then job protections for caregivers. Those are huge things that would go a long way to help all the different areas and really move the bar and allow women who either provide care, paid or unpaid, to help accumulate more wealth.
Thank you. Jessica, All Our Kin is such an inspiring organization, and I think we have so much to learn about the model that you and Jana have pioneered. And so, can you tell us a little bit about what some of the key wraparound supports for childcare entrepreneurs that you all have helped develop, and also what lessons we can take from All Our Kin to maybe apply to community investments in other sectors besides childcare?
Yeah, that's a great question. So, obviously the first thing is to offer professional training, as you would in any profession, about the specific skills and knowledge required. So in this case, that means child development, it means curriculum planning, it means all the things that go into being a wonderful educator, and to make sure that the quality of training that family child care providers receive is the best that we know how to deliver. But we can't stop there, right? Because if you run a family child care, you are indeed a business person. You are a business owner. You need to understand marketing, cash flow, contracts, and policies. And it's really important that we deliver and offer that training so that family child care educators can be successful. And by the way, it is particularly hard in all aspects of domestic work to negotiate these very complicated relationships between families and caregivers, and that is equally true for family child care providers. So really being able to set boundaries in a respectful and thoughtful way is super important. Community connections, really looking around at our health systems, our mental health systems, our K-12 systems, but also, the drivers of economic development, small business investment programs, economic development corporations, making sure that family child care providers have access to those supports and services, and perhaps even more profoundly, creating spaces where family child care educators can come together, can learn from and network with each other, because it's really hard when you're with kids by yourself 10 through 12 hours a day to build that professional network. So creating those spaces to learn from, to lead, to inspire, to build advocacy coalitions, and to really work together to lift up the field as a whole. And the last thing we need that we can't create at All Our Kin, but that we're hoping to really push on, is stable, reliable funding. So that business people know that if there is a subsidy committed to a child, that payment is gonna be forthcoming, that a family that is eligible is gonna be able to pay for care, and that they're gonna be able to rely on that funding to sustain their business over time.
So a question I find really interesting in thinking about this is the impact of technology. So I rely a lot on care.com. I've hired dog walkers on Rover. And so it's nice because it provides an opportunity to hire people quickly and to, some of them provide vetting and assistance with that. But that sort of quick gig economy convenience may be coming at a cost. And I'm wondering if you all can speak to what that looks like from each of your perspectives.
Okay, so it's interesting because we keep talking about the cost and we keep talking about how workers at the bottom, right, at making very small wages. And that's really important because a lot of the money is not making to the workers. So we know that a lot of the recipients, the care recipients, are paying a lot. And we know that the workers are not getting the money. So where is the money, right? Who's keeping all the profit? So that's a good question as well. And I think that's one thing that we need to figure out too. If it's the case so expensive and workers are poor, here at the end they can barely making at the end of the day for the families. So we also need to look at the entire system as you're speaking about, because that's one of the big conundrum that we constantly talk about is that workers are not getting paid barely enough to, if you look at some of the national surveys, some of the workers, they are working full-time, they're not even making enough to provide food for the kids. They go without food at times, if you look at the survey. And I think that's a big question that we need to ask too, because we also, as we work with the Bill of Rights around the country in different states, our workers also are painted as being greedy when we know many of them are not making enough to eat. So I think that's an issue that we can deal with graphically later on, but I think it's important to put it out there that workers are not making money and care is expensive, so someone else is keeping all the money, and we need to go figure out who has all the money, right? So I want to put that out there. And in relation to Bill of Rights, I just want to really quickly remind you that we still have to work on the Bill of Rights in Connecticut to fully make sure all workers are included, and those exclusions that were put in place in the 1930s, they're still in place. Most of them are still in place here in the state of Connecticut, and we need to work to remove them like we've done in other states. So,
Do you guys want to?
I think that your comments really touch on the technology factor when you're looking at the gig economy, because you don't have the same job protected rights, you don't have the same benefits. So you're really asking, I think technology, we have an opportunity with technology to connect those who need care with those who provide care, but we need to make sure we do it in a responsible way that is looking out for the best of the people who are providing the care as well as the people who need the care. So I think that it needs to be an intentional task to really look at the way we use technology. We can't just kind of say, oh, we're going to design this app and it's going to be great. As we're seeing with a lot of the gig economy stuff that's going on, workers are upset. Uber workers are upset. I've had friends who worked for Rover who say, we're on our own, and so we just need to be very careful about how we do it. It needs to be intentional.
there are more misclassification, and the money is going someplace else, not to the
Exactly.
workers.
Yeah.
So I just want to add a slightly different perspective that is not about the gig economy, but just about technology as a tool. I do think it's worth noting that technology is a great way for information and connection to happen. So for example, many of our family childcare educators connect via Facebook. Many join WhatsApp groups, and these become really valuable ways of sharing support and information. Even if you're having a crazy day with the kids, you can take a little time to share a message, to connect, to get support, inspiration, to organize and share ideas. The other thing is an interface for parents and educators. So at All Our Kin, we've created an online provider showcase where the best of our family childcare educators can actually show what they do, can demonstrate how far their work is from the pictures some people may have in their heads, and where parents can get really accessible, transparent information about finding high quality care. So technology certainly has its pitfalls, but it offers some opportunities as well.
Okay, we have 2 minutes left, so I'm going to do a lightning round question, which is, what do you think, if you could have like your single wish list item for policymakers, what would it be?
Oh my God. I mean, I'm just going to echo, we need to value care. It is vital for the fabric of our society. These are important jobs. This is an important role that people play, whether it's paid or unpaid. One thing I like to throw out there is a colleague of mine did this analysis, but if you look at the average earnings for parking lot attendants, those who we pay to watch our cars, it's actually significantly higher than the average earnings for child care workers, those we pay to watch our children. So value is a little bit skewed there, so we need to value it.
Yes, that makes sense.
Yeah.
So it tells you it tells you how do you value your parents and how you value your children,
Yeah.
how much you value your caregiver, right? That's very important. So yes, I think that I'll stay with that.
And I'll just add one more. I want to see every single presidential candidate put forward a vision for a universal child care system that has 3 characteristics. It's for children 0 to 5, so it includes infants and toddlers. It's a mixed delivery system, so it values and supports not only child care centers, but family child care and family, friend, and neighbor caregiving as well. And it's universal. It recognizes that middle-class families, too, have challenges paying for care, and so there's subsidy across the spectrum.
Sounds great.
I wish we had some presidential candidates in the room tonight.
So I know you must have questions as well. There'll be microphones going around. So we're going to open it up for questions. I see one hand right here.
Hi, I'm Leslie Mills, and I own a home for company. I wanted to direct this primarily to Jessica, but anyone else can chime in. I've always loved the model that All I Can has. It's simply brilliant to take a mother who has a child and has to stay home, to open up her home and become a business and take in other children so those mothers can work. For the first time today, listening to you, I wondered, could we set this up for elders? Particularly elders who, women out with the men, they have large homes often. They don't really want to leave their homes. And women stay very active. I wonder if that model might possibly work, or are grown-ups of that age too recalcitrant to obey and go where they're supposed to when they're told.
So let me first just make sure I get the vision. So is the vision that essentially instead of childcare, it would be a safe, supportive space for elder care? Yeah, that's really interesting. I mean, my initial reaction is just, that's fascinating, and I haven't thought about it at all, but boy, I'm really curious to think about it. I bet some of the other folks here have more thoughts.
I was just going to say, the only thing that I've ever heard of that comes close to this, and I'm forgetting the country, but they've been doing these pilot programs where they bring in young children before school age into nursing homes. And so they basically run the child care center out of the nursing home, so you actually have interaction between, so you have, elder care and child care in the same space. And I have, and that model has fascinated me as well, so.
That's very interesting because my mom is 86, and my sister, who watches her, brings her 2 friends over when she's in school so they can have coffee, but I never thought of it as they're watching each other. But it is a very exciting idea because, they can provide support, and a lot of them end up being alone all day long, so that way they are together. It's something to think about.
All right, thank you. Here's another question.
Good evening. My name is Claudette Kidd from Mothers and Others of Justice, and my question is to Jessica. I wanted to thank All I Can because I was a parent who used your services back in 2004, and I had my own daycare services within my home, and I provided that service because I lost my job due to an injury, and I had an infant, and I figured out I need to make an income. What do I do? I'm a teacher, I've got all these skills, and then I said, daycare in my home. And I don't know how old all my kid was at that time, but I started digging for information, got all the information, was speaking with people in the company, and got on board. And I must say that it's very similar to being a teacher, or the training that was received. It was linked with the Children's Museum, and we had the meets on every Thursday at the Children's Museum, and was even featured on Channel 8 News. And so I just wanted to say I'm glad to see it still up and running, and I can vouch that it was a great program. Still is.
Hi, my name is Georgia Jefferson. I'm a librarian at the university, just right down the street. And I just wanted to sort of piggyback off of the last question that y'all were answering, the value of the work. This is going to be a really broad, probably unanswerable question, but I work in a profession that is female run, but not necessarily female dominated, like nursing, like teaching. And I'm wondering, these are lower paid professions, and I'm wondering what are some of the ways that we can combat this systemic belief that women's work is less important? Because it seems to me that we can't value the work. We don't actually fundamentally value the work. So I was wondering if y'all had any thoughts on that. I'm sure maybe you do.
I can take that one. I feel like that's what I do in my daily work, actually, at IWPR, and that's a lot of what we're trying to do as an organization. And one of the reports I wrote is undervalued and underpaid in America, women in female-dominated jobs. So, and the big takeaway is that a lot of this work, as was alluded to earlier, is traditionally done hidden in the home, traditionally done by women, or in legacy of slavery and other people, importing other people in to do this work. I think we just need to keep beating the drum that this work has significant value to our society. At IWPR, we talk about how we provide the business case for gender equality, which sounds kind of icky sometimes, but if we could win these arguments on morals alone, we wouldn't be here today. And so sometimes we have to provide dollars and cents, and we have to do studies of what is the value of home caregiving to our community. Unfortunately, I would put a plug in for additional research like that, and like the ones we do, and we'll continue to do that work. But really, I think it takes changing minds, which is really hard.
Okay, we have a question here.
Hi, my name is Amy Kesselman. I'm a historian of women. And in 1970, Nixon vetoed a comprehensive Child Care Act that incorporated at least some of what Jessica talked about. And when he did so in the context of a political and ideological argument that this kind of care would undermine the male-dominated family. So I wondered if any of you could talk about the politics and ideology that is part of all of the struggles that you're talking about.
Stop them.
Yeah.
Yeah. It's a big question.
Yeah, so I mean, I think none of us are answering because each of us would spend like 45 minutes on it. But I will say one thing really quickly. All Our Kin was created in response specifically to welfare reform and to the idea that women who did not earn a lot of money should move into the workforce very quickly, should be in job training programs, even if they had no safe, adequate place to put their children.
Yes.
And there was a childcare training movement that sprang up around that time that really devalued the profession.
Yes.
You know, it was like, let's just give minimal training to folks and have them care for each other's children. There was a line in a New Yorker article that said, welfare reform is a Ponzi scheme whose currency is children.
Okay.
And so I think these ideas around caregiving, around who should care for children and who gets to decide, and the stereotypes that we have around caregivers, right? These are so profoundly embedded in the way that we think about childcare and about caregiving work. And then when you layer onto that this whole constellation of ideas about how a woman should be home and with her infants and her toddlers, even if there's no way for her to make a decent living or for her family to survive. You know, we have so many pressures pushing against meaningful choice for women and actually valuing of women's choices. I don't know where we start in dismantling that, but I thank you for raising it up for us.
Thank you.
And I would
All
just
right.
add that welfare reform was passed by was signed into law by a Democratic president. It was Bill Clinton. So I think we are it's a really important question. It's one that we need to keep our eye on the ball, no matter who is the front runner from either party. And it's something that we have to continue to push our policymakers to be moral about.
Yes.
Okay. Do we have time for one more question? Yes.
I am the director of a Silicon Valley-based software engineering school that came to Maven a few short months ago. And I heard a lot of conversation about some of the things that are more systemic issues, right? And clearly there's an important point you can make about valuing the work of caregivers, acknowledging the fact that in many cases it's women who are in these caregiving jobs for obvious reasons that we do not need to get into. And in some ways that's irrelevant. However, I feel like there's a whole group of women who are short-time caregivers for one reason or another, right? And we talk about some of the impacts of women having to, or caregivers having to drop out of the workforce. And I guess one of the, and I'm trying to formulate a thought, and it's coming tonight, one of the things I picked up on is, so if caregiving is more traditionally viewed as women's work, what about something like technology, right? There are so many open technology jobs. The average salary of a software engineer, by the way, for the state of the United States is $103,000, right? How do we help women pave a path, especially if they've had to drop out of the workforce, to take advantage of some of these opportunities that are just popping up everywhere, right? Especially in the technology sector. And on the flip side, that is traditionally viewed as a man's job, right? To say it briefly, right? We have something like less than 15% of women in software engineering jobs, technology jobs. By the way, less women in technology jobs today than compared to the 1980s, right? So I don't know if I'm actually asking a question, but I would just love to hear your thoughts on that, because there's that other side of it. How do we help women get back on track? How do we help send a message that there are opportunities even beyond that short-term caregiving time frame?
So this is actually another area that IWPR works a lot on, and we have done a big project on getting women into what we call middle-skilled, well-paying jobs that actually maybe don't need a college education even. And there is a way to actually go and look at your skills, individual, they do a breakdown of skills, and see what other jobs that pay more have comparative skills. So I think there's a way of, one, it's not always about training women for new jobs. It's about understanding that we all have a host of skills that we bring with us even from work that you've done at home, unpaid. You have skills. Those are concrete skills that can be applied to a paying job. Now, a lot of people don't look at it that same way. They don't look at the qualifications that same way. But there actually are tools out there, and we host one on a website that you can go in and you can look at your qualifications and see what other jobs have those similar skills, time management skills, people management skills, all those different kinds of things that we don't necessarily think of as transferable, but are actually readily transferable and could get more women into higher paying, traditionally male-dominated fields.
I want to thank you for also bringing that up, because you brought in a very important point. It's the idea of intersectionality as well, and barriers that many minorities have to accessing other positions, right? So if you think about intersectionality, we're talking about race, gender, class, immigration status, right? And also the fact that in many cases, a lot of the women who are doing these jobs, those are the jobs that they're going to have, right? And not just because by choice, but because those are the jobs that they're going to have. There's not going to be many other opportunities for them pathways for them to do other jobs. Some they're going to do it because they like and they love that job, and others they're going to do it because there's not going to be any other opportunity for them to do. It's like being trapped in poverty. You trap, and that's it. You can pick up and go. And I think it's interesting for us to talk about this, because we have to think about some people are going to have opportunities and other people are not to. So I think as agents of change, we have to create good jobs in every sector. Right? We have to think, okay, yes, there are those good jobs here, and there are those jobs that someone's going to have to do them. So those jobs, they have to be good as well. We have to put time and energy into making all jobs good, all jobs fair, all jobs just, no matter what they are, because we need all of them, right? And someone's going to have to do them, okay? So I think that's very important to keep that in mind. All right, so thank you.
Thank you. So we're going to wrap up. I wish we could stay here and talk all evening about this topic, but thank you to Miriam Gohara, Natalicia Taylor, Elise Shaw.
Tracy.
Oh, sorry, Jessica Sager.
I'm Irish.
Sorry. You guys did a great job, and I look forward to talking with you more.